And we go on with the slides. So we've discussed the abbreviations on this slide, and okay. Now, if we move to the next slide, we can see here more abbreviations, and so they are organized in a chart, and you can see here the names of the headings of the columns, the names of drugs in the first left-hand column. They are paracetamol, loperamide, ranitidine, atorvastatin, and so then there is a column with dose, then the column frequency, route, and maximum dose for a day per 24 hours. So, and the example, we should just write the sentences about each line, and there is an example here for the first line about paracetamol. As you see, give the patient 1 gram of paracetamol, 1 gram of paracetamol 4 times a day by mouth up to a maximum of 4 grams. So this is the sentence. So please write similar sentences about the 3 drugs which are given lower, using a similar structure, like give the patient between and give up to a maximum of. So please, just 3 minutes for you to do this. Start, please. Okay. So let us listen to Taib. Will you just read the sentence about loperamide? Taib?
Yes, ma'am.
Mhm.
Yes, ma'am.
Okay.
Give the patient 4 milligram of loperamide when required in a day by mouth up to a maximum of 16 milligram.
Okay, good. Now, please, Labib.
Yes, ma'am. Give the patient 115 milligram of ranitidine twice daily by mouth up to a maximum of 300 milligram.
And how often? What is the frequency? I missed it.
Twice daily.
Twice.
BD.
Okay, yes. The next is for Hepzibah, please.
Okay. Give up to maximum of 10 to 80 mg of atorvastatin once a day by mouth up to 80 mg.
Milligrams. Okay, good. So this is the way of saying what is written in prescription. And now we are going to study a drug chart. So a drug chart is so the chart which tells us about the name of the patient and the name of the drug which is prescribed, the dosage, and all the other necessary information. And it is used in a ward in a hospital. So the example of such drug chart is given here on the slide, and you can see that there are several gaps here. We should study the chart and just to make sure that we understand the abbreviations, the headings, and everything here, and then we'll listen. First, let us just look through the chart. Here we have the name, we have the heading patient. It means that we need to write the name of the patient. Here, this is Mrs. T. Hawthorne. What about DOB? DOB here? What do these letters stand for?
Date of birth.
Okay. Then there is hospital number. Drug. What should we write here in number 1?
Which type of drug is used?
Yes, the name of the drug. Date.
That particular date.
Okay, the date. So the date of the conversation. Yes. Then route.
Through
The route
mouth
of administration of the drug.
Yes. Yes. How it should be. It should be taken. Route of administration. Dose we see 50 milligrams. Start and time.
one have to start
Yes. Taking
According to the
medicine.
time when the administration starts.
And what time? Okay. Maximum frequency is this is OD, or so these abbreviations we were discussing, like ON, BD. How many times? And we see maximum dose. And number 7 is indications for use. Indications for use. This is also about how the medicine should be used, and also the route is
by which
similar.
the medication can.
Yes. And there is, in the last line, we can see the signature of the person who prescribes this medicine, and given by. What should be written here?
The pharmacist.
Name of the
Pharmacist.
Or the person who should give the medicine to the patient. Yes. Now let us just check it. We're going to listen to a doctor checking the chart with a colleague, and we should complete the missing information in the chart. So please take notes. on paper while listening. And please tell me if you hear or not.
Unit 5, Listening 1.
Can you hear?
Yes, ma'am.
Okay, so one more time.
Unit 5, Listening 1.
Let's see now. Mrs. T. Hawthorne, date of birth 4th February 1963, hospital number 1834572Z. She was prescribed tramadol today, 15th October 2009, given intramuscularly 50 milligrams, started on 13th of October at 11:30. All okay. Maximum frequency every 4 hours, maximum dose 600 milligrams. Okay. To be administered as required intramuscularly and given by Senior Nurse Bond.
Do we need to listen one more time?
Yes, ma'am.
Yes, please.
Okay.
Unit 5, Listening 1.
Let's see now. Mrs. T. Hawthorne, date of birth 4th February 1963, hospital number 1834572Z. She was prescribed tramadol today, 15th October 2009, given intramuscularly 50 milligrams, started on 13th of October at 11:30. All okay. Maximum frequency every 4 hours, maximum dose 600 milligrams. Okay. To be administered as required intramuscularly and given by Senior Nurse Bond.
Okay. So what is the name of the drug here?
Tramadol.
Tramadol. Yes. Date.
15th October 2009.
2000 and what is the year?
2009.
Yes. 2009. Okay. So route of administration. Intramuscularly, she says. So and so they started when?
13th October.
11:30.
11:30. Right. Yes. Maximum frequency every
4 hours.
4 hours.
4 hours.
Okay. So and the same indications for use.
As required.
As required. Yes, as required. This is PRN pro Renata. And the route is intramuscular. Okay. And what do we write on the last line here?
Senior
Nurse Bond.
Senior Nurse Bond. Perfect.
Bond.
Okay. So this is the example of a drug chart. And if we move to the next slide, yes, we can see a nurse. So her name is Joyce Kame. And we are going to read what she says about her job. So it's my job. This is the article. And it is divided into several parts. And yes, now we'll read it and then we'll do some tasks on reading. We'll answer the questions. So please be just careful with reading. And now let us listen to Ansila. The first part is for you.
I work as a nurse practitioner at New York City Hospital. I'm a registered nurse who has completed specific advanced nursing education. I have masters in cardiovascular medicine and training in the diagnosis and management of common medical conditions in this specialty.
So we see NP stand, these letters stand for nurse practitioner. Okay, and this is about her education. Now the next part of the article is for Asna, please. Read it.
Okay, ma'am. I provide much of the same basic non-emergency care provided by physicians, generally of the type seen in the specific practice areas like family practice officers, urgent care centers, and rural health clinics, and it maintain collaborative working relationship with physicians. As an NP, I am licensed by the state in which I practice through the NCC. This is National Certification Corporation for Specialty Practice. Rather than a generic focus of education as a nurse practitioner, I am able to specialize in an area of study I desire and provide care within the scope of my expertise.
Is everything clear here? Okay, so this is about, she speaks about her responsibilities comparing with the ones which are done by physicians, right? Okay, well, for the next piece of information, yes, let us listen to Shamisha, please.
I may treat both acute and chronic condition as well as prescribe medications and therapies for the patient at hand. The core philosophy of the field is individualized care. Nurse practitioners focus on patients' conditions as well as the effects of illness on the lives of the patients and their families. Informing patients about their health care and encouraging them to participate in decisions are central to the care provided by NPS.
NPS, which stands for nurse practitioners, right?
Yes.
So, okay. This is also important about the philosophy, which she follows. And if we move to the next slide, here there is information for Ramisha. Read it, please, Ramisha.
Yes, ma'am. A major concern for myself and other medical practitioners at all levels is concordance. Once a drug has been prescribed, concordance involves a process of prescribing and medicine taking. It is a kind of partnership. It is not just a matter of explaining the benefits of prescribed drugs and side effects which can sometimes happen, but which may not. Improving concordance is about involving the patient in making decision about treatment.
And here is the definition of concordance given. This is a noun. This is a process whereby the doctor and the patient cooperate in the prescribing process to maximize the taking of medication. This is a kind of agreement between a doctor and a patient. And so we've read the information, and here are the questions about the article. Let us look at the questions, read them, and answer the questions. And the first is for Jan Farvin. Jan Farvin, please.
Is concordance a cause for concern for nurse care and her follow NPS? We can say a concordance, a process whereby the doctors and the patients cooperate in prescribing process to maximum of taking the medication.
She can say the central philosophy of working.
Who is speaking? Okay. Yes. So we can say that this is a case for concern for this nurse. Yes, nurse practitioner. Okay. The second question is for Halamali, please.
What type of conditions can she treat? She can treat both acute and chronic conditions.
Mm-hmm.
She
Exactly.
can also prescribe medications and
What does she consider the
therapies for
central
patients.
philosophy of working as a nurse?
Just a minute. Somebody is speaking at the same time. Okay, who was that?
Philosophy of the field is your life.
Who is speaking about philosophy? What's your name? There are some problems with connection, maybe. Okay. Yes, thank you. Sultan. Hello, Sultan.
Yes, ma'am.
Yes, number 3, please.
What does she consider the central philosophy of working as a nurse practitioner? The core philosophy of the field is individualized in care and nurse practitioner on patient's condition as well as effect of illness on the lives of patient and their family. Informing
Yes, so-
patients the healthcare and encouraging them to participate.
Yes, individual help
Center to care provided by the
patients.
NP.
Okay, thank you. So that was Sultan. Now Sinju, please. The next question.
Why does she feel patients need to be involved in treatment decisions? It is mainly to improve the concordance, that is the maximize the taking of medicine so that the doctor, the patients as well as nurses can also be involved in decision making. So it would.
Thank you. So then Danish, please. Question number 5.
What specific postgraduate training has she undergone? The nurse undergone masters in cardiovascular medicine and also she is training in the diagnosis and management of common medical conditions in this specialty.
Okay, good. So the next one is for Shwati.
Yes, ma'am. How does her work compare with that of the physician? She provide of much of same basic, there is no emergency care provided by and they are generally of a type seen in their specific practice areas like family practice offices, rural health clinics, maintaining the collaborative working relationship with the physicians. So that is the relation.
Good. So this is the information about responsibilities of nurse practitioners, and so the question is, who do you think should have the right to prescribe medicine? Because there was information about prescribing medicine. So like, are nurses allowed to do this? Who should have the right to prescribe medicine? What do you think? Let us listen to Taib, please. Taib.
Yes, ma'am. Actually, doctors as well as the nurses, they could discuss about how the medicine is prescribed. So it's better they discuss and then prescribe the medicine.
Should nurses be given the right to prescribe medicine?
Yeah, so they could discuss and finally reach a conclusion about how the medicine should be prescribed and which is better and how much is better.
You are speaking about the discussion. They have the right to discuss with the doctors, and the final decision should be given to the doctor, right?
Yes, ma'am. Final decision should be given to.
I see. So do we all agree with this point of view, with this opinion? Or do you have a different opinion?
Ma'am, it is said that if it is really necessary, it is in such a situation that if doctors are not nearby and all, then the nurse can prescribe the medicine, and that also is in non-emergency case.
What about pharmacists? Should they be allowed to prescribe medicine? Pharmacists.
Yes,
For
ma'am.
example, if you go to a pharmacy, so just you have a headache, you can get just an expert advice from a pharmacist what kind of drug to take, right?
Ma'am, I would say that in fact, for a pharmacist, there is a limitation for prescribing medicines. They cannot prescribe every medicine, and they can prescribe medicines for some suppose headache or just a which is vomiting, and they can prescribe medicines for a particular type of disease only. They cannot look after for a vast kind of disease, and it also vary from country to country. In different countries, there are different regulations for the pharmacists to give medicine.
Okay. Great, thank you. So, and the next question is, do you have nurse practitioners or nurses with similar roles like it was described in your country? Nurse practitioners. Do you?
Yes, we have.
You have. Okay, good. So, and the next piece of information is about benefits and side effects of a medicine. And here you can see that we are going to listen how the doctor explains the benefits and side effects of aspirin to a patient, Mr. Johnson. Mr. Johnson is being discharged after an uncomplicated MI. MI stands for myocardial infarction, which is the same as heart attack. And discharge here, this is tell someone that they can leave a hospital. So they are speaking about side effects of aspirin. And so if we move here to the next slide, we can see there are some sentences from their conversation, what the doctor says to the patient. And the task here is, in your own words, complete the blank spaces in the doctor's sentences. For example, if we have a look at the first sentence, it says, I've got some good news for you. You've made, and we are going to, you've made what? What is missing here? What can we?
Progress.
Progress or?
Progress.
So, yes. And we are going to discharge you from the hospital. Yes, please have a look at other sentences and in your own words, just try to complete them, try to think, predict what is missing here in the sentences, please. A couple of minutes for you. Start, please. Well, let us start checking what we've done. So sentence number 2. So let us listen to Danish.
Yes, ma'am. First, I'd just like to have a brief chat with you. About
What about?
Procedure or medication.
About medications. Okay, good. So Ashwati, the next sentence, please.
Yes, ma'am. If at any time you want to stop me and ask questions, feel free to do so.
You
There
may
is a
do
lot
this.
of information to take in at one time.
Okay, so Taib, the next.
We are going to give you a very small dose of 75 milligram. It's a much smaller dose than you would normally buy over the counter. You take it for free.
Okay, take it for free. Okay, good, because the insurance covers it. Yes, possible. Okay, so Labib, please.
Yes, ma'am. The aspirin will help you a lot as it thins the blood and also it prevents the further attacks.
I see. Okay, Hepzibah, please.
And I emphasize the word possible as you may not get them. But I just have to point them out so that you are aware of them and can do something about it if anything happens.
I see. Okay. Ansila?
Sometimes people get
We speak about aspirin. This is the sentence about side effects. So what can happen to people if
allergies?
Allergies, yes. And aspirin.
Or aspirin can make irritable.
Okay, anyway, this is the information about side effects, yes, and complications of aspirin. Well, good.
Or it can cause some.
What? Sorry?
Or it can cause some side effects or complication.
I see. Okay. Well, now let us just listen to the doctor, to the conversation between the doctor and the patient we were speaking about, and so complete the sentences with the what was really said by the doctor, which is quite the same as you've said.
Listening 2.
Good afternoon, Mr. Johnson. My name is Dr. Howard. How are you today?
I'm fine, Doctor.
That's good. Well, I've got some good news for you. You've made very good progress and we're going to let you go home.
Really?
Yes. But before you go, there's just 1 or 2 things to do. I can see you're very pleased about going home.
Well, I am.
Well, we won't keep you long then. First, I'd just like to have a brief chat with you about your medication.
Okay.
We're going to give you lots of tablets to take with you and make you rattle a bit.
Okay. I thought that might happen.
Right. Now, if at any time you want to stop me and ask questions, feel free to do so. There's a lot of information to take in at one time.
Yeah, fine.
The first tablet, which I'm sure you're familiar with, is...
What is it?
This little white one, aspirin.
Yeah.
We're going to give you a very small dose of 75 milligrams. It's a much smaller dose than you'd normally buy over the counter. You take it by mouth once a day after a meal from now on.
Okay. Why do I need to take it?
The aspirin will help you a lot as it thins the blood and so helps to prevent further attacks.
Okay, that's good.
Now, as with everything we take, there are some possible side effects. And I emphasize the word possible, as you may not get any of them. But I just have to point them out so that you're aware of them and can do something about it if anything happens.
Okay.
Sometimes people get an upset stomach, or aspirin can make the stools of some people dark and smelly, or it can cause bleeding, like nosebleeds, or shortness of breath. But remember, I'm just pointing them out to you so that you're aware of them. Also, look at the leaflet that comes with the tablets. If you do get anything, just get in touch with your GP. Is everything okay so far?
Yeah.
Okay. Would you like to go through everything and explain it to me?
Okay, so in the first sentence, we have, he says, you've made a very good progress, and we are going to, what is missing in the first sentence?
Let you go home.
Let you go home. In the second sentence, a brief chat with you.
About medications.
Medications, okay. In number 3, if you want to stop me and ask questions,
Feel free to do so.
Feel free.
feel free. Okay. In number 4, you take it
By mouth once a day after
By
meal.
mouth once a day after a meal.
From now after meal, from now on. Okay. In number 5, so the aspirin will help you a lot as it
Thins the blood and
Thins the
transfer the
blood
habits.
and has
Yes.
further attack.
Thins the blood and prevents further attacks. Emphasize the word possible as
You may not get them.
As you may
any
not
of them.
As you may not get any.
And about complications, people get
upset stomach,
upset stomach. Aspirin can make stool
dark
smelly,
and smelly.
can
Dark
smell
and smelly.
dark and smelly, or it can cause
Bleeding.
bleeding. Yes. Okay, we have less than 1 minute. Let's meet in 10 minutes and just listen to your presentations. Okay.
Yeah.
Okay.